Is it recording? Okay. All right. I'm Elizabeth Peterson, and I'm an RBT with CCABA.
And I'm Lauren Broadwell. I am a BCBA and a clinic lead at CCABA's Huntersville location.
And for our poster, we did the utilization of stimulus-stimulus pairing to establish stimulus control of vocal speech sounds. The purpose of implementing this intervention of using stimulus-stimulus pairing with vocal sounds was seeking to increase verbal speech production with an individual that was using PECs. This intervention was implemented with a 4-year-old male with ASD and in the clinical setting with 2 RBTs. For the method in phase 1, the team's goal was to increase the client's rate of babbling. The team collected baseline data on the babbling sounds any instance the participant emitted a sound with his mouth open. The client was emitting during 10 consecutive sessions. The following sessions consisted of the RBT providing reinforcement to the client for emitting any sound. Once there was 2-second delay between the sounds, the team would provide reinforcement again. For example, the participant would emit the sounds ah, ah, ah. Reinforcement was provided once. If the participant emitted the same sound but with 2-second pause in between, for example, ah, 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 then reinforcement would be provided 3 times to the participant. In phase 2, the team began stimulus-stimulus pairing and data collection for a 20-minute duration during each session. The team used the data from phase 1 to identify the participant's most frequently made sound, which was duh. During this phase of intervention, the RBT would provide the individual with the target sound up to 3 times before collecting data. If the client emitted the correct target sound when the first or second duh was provided by the RBT, data was collected and the participant was given reinforcement. If the client did not emit the correct target sound duh after the third SD had been given, the RBT then reinforcement was not given, and the RBT simply stated, "Nice job trying," and would provide the SD duh again. After a few sessions of running the goal, the client began to withhold emitting the target sound during the second half of the 20-minute duration. There was a program modification made for the duration of running the goal to be 10 minutes. The data was variable after this change, and another program modification was made to use error correction to support the client in meeting mastery. The duration stayed at 10 minutes. For example, the RBT provided the SD duh if the participant did not emit the target sound. The SD was provided again. Once the client emitted the target sound, the RBT would run motor imitation distractor trials and then provide SD duh again. Then we moved to phase 3, and the target sound duh was introduced in task interspersal. The RBT would run 2 to 3 goals that were in maintenance and then provide the duh sound for the participant to echo. For example, the RBT would provide 2 fine motor or simple motor imitation skills that were in maintenance and then provide duh. For example, do this, touch your head, copy me, clap hands, and then provide the duh sound. Data was collected on the client emitting the sound or not emitting the sound during the trial, and reinforcement was given on a VR5 schedule. And I'll pass on to Lauren to talk about results.
The graph that's on the top right-hand side of the slide shows the rate of babbling that our participant engaged in baseline as well as an intervention. The axes show number of sessions, and to indicate here, there were multiple sessions ran within the client's time at the center each day. So oftentimes 2 to 3 sessions were run per day. And the data showed that with the use of stimulus-stimulus pairing and the utilization of an FR1 schedule to reinforce vocal sounds, the participant's rate of babbling increased to over 10 times per minute in comparison to an average of 2 times per minute in baseline. And from here, we were able to then go into moving into implementing stimulus-stimulus pairing with our client to really gain stimulus control over the sound duh, which was the sound that the participant emitted most often. And throughout intervention, once we got to our final modification within stimulus pairing of adding in error correction during the stimulus pairing procedures, our trend line became much more stable when the participant was able to quickly meet mastery criteria following this change in intervention. And then in addition to that, the data show that the participant was able to perform this skill within task interspersal within with other high probability targets, which really shows discrimination and stimulus control of that sound that we were targeting. And I'll pass it back to Gracie.
Sorry. At the intake, the participant was not producing vocal sounds other than laughing and crying. After implementing the PECs with the participant, he infrequently began to babble. Future researchers should evaluate the effects using PECs has on the production of vocal speech sounds in individuals with ASD. Based on the data above, in order to establish stimulus controls of echoic responses, stimulus-stimulus pairing can be effective. Future researchers should see if the results of this procedure may be replicated. Potential influences to the variability trend line in this procedure with the participant are that there were multiple pauses within the client session due to various reasons. Overall, the participant began producing more frequent vocal speech sounds and would emit vocal sounds for a longer duration. The next steps for this team would be to gain stimulus control over more speech sounds and shape them into single syllable sounds into words.